Hello, and welcome back to Meeting Grief and Loss with an Open Heart. So, I always get questions about just stress, just feeling anxious. And as we've talked about in the course, there's a lot of reasons to feel stressed and anxious when you have a great loss in your life. One of the things that you should know about your heart is that your heart is supported by your breathing. So, I'm just going to show you a couple pictures from Anatomy of Breathing uh, by Blendine Germain. And this is a picture of your diaphragm sitting in your rib cage. So you can see it looks a little bit like a double-headed jellyfish there. I like the image of a jellyfish. This is what it looks like if you're kind of inside your body and looking up. But we'll focus on this view. And you can see there's a little black spot there. And what I'd like you to think, even though it doesn't show in this picture, but what I'd like you to realize is that your heart sits there right on top of your diaphragm. So we're just going to do a little bit of a breathing exercise. And first you want to locate your diaphragm. So I know I'm moving my screen. I'll move my chair back a little too. So you have a breastplate, right? This bone comes down the center of your chest. It's kind of squishy at the bottom, and a bra line if you're a woman. And if you kind of go out from that squishy part and you start tracing your ribs, and it dips down a little bit into your back, but your diaphragm is three-dimensional in your rib cage. That means it's in the entirety of your rib cage, and I'll show you my little picture again. And what happens, if I had a little video of a jellyfish, I'd probably put it in here. I don't know how to do that. But just like a jellyfish, when you breathe in, the diaphragm dome, that top part that's like the jellyfish's head, gets a little flatter. And when you exhale, the dome raises. So just try this. Try inhaling. There's less of a dome. Exhaling, dome goes up. Now, if you're really anxious, I'm also going to add that you should make your exhalations nice and long. Maybe add a little hum to them. That helps the exhalation come out. So you can just go, So longer exhalation is related to relaxation. You can also see my elbows are moving, and my elbows are the stand-in for the sides of my ribs here. So as I breathe in, it's not about belly breathing. That does happen to a certain extent, but more you want those nice sides of your rib cage to expand on the inhalation. They get higher and wider, and they get lower and drop on your exhalation. And then it's like just having something on your hands. I'm dangerously using my phone, but I am. Your heart is just gently going for a ride on your hands. Your lungs are inflating as the heart drops, and they're kind of hugging your heart. And also your heart is moving up into the lung space as you breathe out. And this effect can be kind of hypnotic for sure. And that's good because it's a method you can use. It doesn't so much keep your heart open as keep your heart resilient by it just riding its natural waves with your breath.